Hi class, my name is Samson Osimo and my PowerPoint presentation is on social determinants of health in LGBT groups. Who are LGBTs? The LGBTs are the lesbians, gays, bisexual individuals, transgender individuals. LGBT individuals span across all races and social classes. National surveys cannot capture their numbers effectively due to sexual and gender orientation questions are not asked during surveys. Source of health disparities. Source of health disparities. Disparities is common due to number one, social stigma. Number two, open discrimination. Number three, denial of civil and human rights. Social stigma. LGBTs are not socially accepted by their families and communities. And open discrimination often leads many in the LGBT groups to high cases of mental illness, substance abuse, and suicide. And also, the LGBT group have been victims of violence and victimization without full legal representations. Social determinants of health. The LGBT groups are denied access to social services and rights such as health insurance, employment, housing, marriage, adoption, and lack of legal law preventing bullies in schools. And also lack of social programs targeting LGBT groups, which cut across youth, adult, and geriatrics. There is shortage of trained healthcare personnel on matters as affecting LGBT, as LGBT group requires knowledgeable and culturally sensitive individuals to address their different healthcare needs. Healthcare concern among LGBTs. The healthcare concern leads to suicide. There is high rate of suicide among LGBT youths. The number is 2 to 3 times higher than non-LGBT youths. Homelessness is also a concern. Homelessness is high among the LGBT group due to housing discrimination. Cancer screening and prevention is also high among the lesbians due to little access to preventive services. And there is increased risk of HIV and STDs among gay men, especially men of color. Healthcare concern among the LGBT group elderlies is impeded by victimization, social neglect, lack of insurance, and lack of access to competent healthcare personnel. Importance of LGBT health. The group health can be improved by enhancing health disparities, eliminating health disparities, enhancing access to healthcare, as this will lead to reduction in transmission or progression of diseases, improve mental health wellness, and increase longevity among the LGBT groups. Improving LGBT social determinants. Social determinants can be improved by including LGBT data in national surveys, which will aid in decision-making on important health issues, training healthcare workers to enhance cultural and social competency, drafting anti-bullying policies in different schools, and lastly, increasing access to social services to deal with suicide and homelessness. This is my reference, and thank you.